Good afternoon, and welcome to the Flexible Regional Medical Center Medical Team Updates for October the 24th, 2021. I'm excited to be with you today to share with you a few of the updates and things and processes and procedures that we will be undertaking over the next several weeks. As we dive into our work today, there are a couple of things. First, I would like to welcome you to the work that we're doing. We're going to be taking a look at departmental updates, what those next steps that we will use to put into place are departmental updates. We'll be looking at professional updates and information systems. We'll be looking at our client services. We'll be looking at some desired outcomes and how we might evaluate the work that we will be doing. And we're going to always be open and ready for the feedback and suggestions that you may provide to us. First and foremost, though, I would like to thank you for the last 20 years that I have been here as a part of this team. It has truly been 20 years of excellence and quality care to our patients. Changes are coming, and quality still matters for each and every one of us. Today, the changes that I'll be sharing with you center around changes that have taken place in federal regulations. The federal government has been making some additional changes and shifts in the work and the way in which we are able to interact and to do our record keeping here within our medical center today. We'll be looking at some professional development and training opportunities that may become available to you. And we're going to also continue to keep in mind that our client services are still of utmost importance to each one of us. So our departmental updates today will center around these changes from federal regulations and some of the things that we need to implement and how these will be done. The first thing that we want to know is that medical care will continue to be provided to all patients that enter into our facility in the best possible manner that we can. Things that will be shifting is we will be looking at our medical records keeping, and we will be shifting from paper, hard copy record keeping to a digital record keeping system for both patient check-in at each of their visits as they come into our practice as an organization. Our nurses will be using nursing kiosks from this point forward. All nursing staff will use a rolling kiosk to record all patient intake information and notes that they may acquire during the initial intake session with our patients. And physicians will begin to do their record keeping using laptops, and they will be assisted to keep their record keeping, their notes, prescriptions, and referrals for all tests and services that they may deem necessary for each and every visit that we have here within the confines of the Flexible Regional Medical Center. There's a four-step process of change that we are going to use. First, this change will necessitate a willingness by all staff to participate in the best possible manner with an open mind and an open thought process so that we're able to meet the needs that have been directed in our way. The process will be followed as accurately as possible in a time that will be shared to assist in the planning and purposes that we will undergo over the next several weeks. Patient care and employee support will remain a priority of us in management here at the Flexible Regional Medical Center today. And as always, communication is key. That is why today we are sharing these important impacts and information with each one of you. The first thing we see is that because of federal regulations, it has necessitated us doing some things in a different manner. We'll be doing some technology upgrades and new equipment will be purchased, and you'll begin to see that equipment arriving here within our center as soon as possible. Our anticipated goal is in the next 2 weeks, hopefully by November the 2nd, you will begin to see those things being assembled and being deployed for the first round of pilot to ensure that we have all technologies in place here within the center. We'll be offering professional development opportunities for all staff so that everyone is capable and able to utilize the equipment in the best possible manner, and questions and support can be provided to all employees. We'll also be doing a deeper dive and a look at evaluation and additional supports that may be necessary and needed by each and every one of our employees. You might say, well, these were just some simple federal regulations that have occurred. Yes, they were. But part of our goal here is to be transparent and upfront and to communicate exactly what changes were included in those federal regulation updates, and the things that we will be immediately implementing here at the Flexible Regional Medical Center today. How will we evaluate our successes throughout this process, and what will it look like? The first thing that we will do is together we will examine the implementation of the new processes and systems that will be implemented here within the center. Remember that these systems have to do with our record keeping, going from paper and pencil, going into a technology-based approach where we will be able to quickly digitally log in, see all records of that patient, and to see how that patient has been treated over the last several times that they have visited as well. All history and notes will be also implemented and being updated within this system by our medical records department today. Management will monitor the workflow, the staff and the client flow regularly, so that this is critical to the successful implementation of the work that we do. One of the things that we have begun to do is we have begun to kind of track and monitor when patients arrive here at the center, how are they greeted, how does that check-in work? And so we've been monitoring the check-in process for quite some time and feel that this new update to a technology-based check-in will assist our receptionist in also making this a better experience for all and gaining as much information at check-in time as possible and keeping the work moving at a specific time. The third thing that we'll look at is professional development, and our check-ins will be provided to increase the comfort and capacity of all staff. By professional development means we will be training you, we will be providing one-on-one assistance as needed, and we will be able to monitor and assist you right on hand. We will have several additional support people that will be on the floor that will, if you call them, will be able to come in and help troubleshoot as necessary. We understand that in the beginning that this may not be a flawless system, but we also want to ensure that these changes are changes that will also in the long run benefit us and make us more efficient and provide a better opportunity for our patients to receive better care and a better and more timely referrals and prescription process as well. It is our goal to not only look at the regulations, but also to implement them in such a way that everyone is impacted in the best possible manner that is available to them. Adjustments will also be made as we digest the reports, survey results, and patient feedback, as well as our staff feedback throughout this entire process. What we have already begun to do is we've already looked at patient experience surveys that have been generated and given and shared within the organization. Those have given us the opportunity to increase and to understand a better flow for our check-in process once those patients arrive. We've also been able to see and examine how they felt throughout the process and how they felt that our services were delivered. So we have already begun part of the evaluation process and the implementation of these new regulations that we have. We'll also be looking at these survey results to also help us monitor and to ensure that we are able to give appropriate measurement to the work that is being done. The implementation of supports and changes in procedures and routines will be made available as deemed necessary and supported by the data that is received from both employees and patients alike. One of the things that often becomes important in this process as well is the ability for us to just take a breath and breathe and continue to work through the challenges that may arise. We will be able to celebrate the successes that we experience, and we will also be able to breathe through those challenging moments and all of the things that we've thrown our way. We understand that today that you might be watching and saying, there are some additional questions and resources that I hope will be answered in a few moments or in time. One of the things we would like to do as well is we would like to give you the opportunity to understand that together we can and will accomplish everything that we do. And we do thank you for all that you do and how you support this system and the processes of the organization as a whole. So today, I hope that through this process, you have been able to see and experience some of the great things that have taken place within our organization.